Welcome, welcome. So good to have you join us on this beautiful autumn Monday. Welcome. Good to see everyone's smiling faces. I know we expect a pretty big crowd today, so I'm just going to dive right in. I'll start by covering some housekeeping items before I turn it over to our guest speaker. But my name is Andrea Miriam. I'm with the Parkinson and Movement Disorder Alliance, and we are thrilled that you joined us today and thrilled to be hosting our expert, Dr. Dana Saffel, to talk about a time sensitive, complex, very important topic. I don't know about you, but watching TV this weekend, I saw a lot of Medicare commercials and I'm in this business and my head was swirling and I was like, wait a minute, there's a lot of nuance and complexity. And so really glad to have Dr. Saffel here to navigate us through that. So the housekeeping items that I mentioned, everyone right now is placed in auto mute, but we still want to hear from you via the chat function. So in the bottom middle menu bar, there's a little speech bubble with a chat. If you click that, why don't we give it a try? And I'd love for you to put in the chat where you're tuning in from, what state, what city, where in the United States are you watching? It's a good way to practice using that chat. That's going to be how you can send questions or comments, and I will pass those on to our speaker. One other housekeeping item, we have enabled the subtitles or transcript function. So if you prefer to either see the words on the bottom of the screen or have a transcript along the side, you can turn that function either on or off, whatever you prefer. And that's in the More section of the menu bar, which again is on the bottom. On the far right side, there's a 3-dot ellipsis. If you click that, you can turn the subtitles on or off or have the transcript. We are recording today's session, as the robot Zoom lady shared. And I know I'm going to be using this as a resource and going back to it to watch again. So settle down, have your coffee or your water, get ready to listen, ask questions, and then we will have both the recording and the slides available so that you can go back and review the material and read it through one more time. Okay, I think that covers all of my housekeeping items. So I will now turn it over to our guest. Welcome to Dr. Dana Saffel.
Thank you very much. I will share my screen, so bear with me a moment and let me get this up for you to see. And let's go to full screen. These slides are available for you to download if you would like to use them at some point in the future or you might want to be taking notes on them if you've already printed them off. But we're going to talk about how to make Medicare work for you. Now, I'm a PharmD. My specialty is geriatrics. My entire career I have spent primarily in the long-term care setting, so nursing homes, assisted living, community care, definitely with people that have movement disorders, Parkinson's disease. I have Parkinson's disease that runs in my family, so I am very attuned to the particular issues of finding good care and coverage for people with movement disorders. So today, generally, everybody with a movement disorder is being covered under the Medicare program. Most of us are in our mid-60s to early 70s when we are diagnosed with Parkinson's disease or other types of movement disorders. And even when we're diagnosed earlier, oftentimes individuals can qualify for Social Security disability and therefore become eligible for Medicare. So we're going to talk about the Medicare program. And the reason we're going to talk about it is you have probably already been receiving tons of mail in your mailbox and emails and TV commercials because open enrollment that allows you to select a new plan starts in another 11 days on October the 15th. And from October the 15th until December the 7th of every year, you have an opportunity to reevaluate what Medicare plan you want to participate in and select a new plan. So let's walk through that. Maybe some of you have not even joined Medicare yet. Maybe some of you are just considering that Medicare will be an option very soon. Some of you may be in your youth, on your 30s and 40s and 50s, and caring for an older adult and helping them make a decision about the best Medicare plan. So we're going to review just a couple of things between selecting a basic plan, and we have two types. We have original Medicare and we have Medicare Advantage. Original Medicare was the Medicare program that was first implemented in the mid-1960s, and it consists of three parts. The original Medicare Part A, which is free for everyone as long as you've worked at least 10 quarters sometime in your lifetime. And you don't have to pay a premium for Medicare Part A. Part B, well, let's just back up. Part A covers hospitalization, and it can cover up to 100 days of rehab therapy in a nursing home. Part B is a type of Medicare that requires a monthly premium, and that is set by Congress each month and each year. And this time it's $149 a month is the Medicare Part B premium, and that pays for your doctor's visits. So almost everybody needs Part A to cover their hospitalization and Part B to cover their doctor. And then about 15 years ago, they started Part D, the drug benefit. And if you select original Medicare, you need to select Part A, Part B as in boy, and Part D as in drug. And you'll be paying $149 for Part B. And then whatever your drug benefit that you select will also have a monthly premium. And most people with original Medicare are also going to get a Medicare supplement, or sometimes called a Medigap plan. And that supplement will be an additional cost per month. And it varies widely depending on what type of supplement plan you choose. But you need to have a supplement because regular Medicare Part A and Part B charges a 20% copay. Whatever the cost is, you pay 20% of that. If you have a Medigap or plan or a Medicare supplement, then that supplement will cover that 20%. I know it sounds complicated, but the big difference between Medicare, the original Medicare, plus your Medicare supplement and your drug plan, is that you get to select many of the options that you choose to invest in. On the other hand, we have Medicare Advantage. And Medicare Advantage has been around for about 20 years, but it's really begun to take off in the last 5 years. And today, about nearly 45% of Medicare beneficiaries choose to enroll in a Medicare Advantage plan. A Medicare Advantage plan is kind of like an HMO or a health maintenance program. And when you belong to a Medicare Advantage plan, you pay one monthly fee, and that covers your Part A, your Part B, your Part D for drugs, and it all, but you don't have to get a Medicare supplement because that plan will offer you lower copays or coinsurance. Now, that's the big difference between the two plans, but you can actually see it spelled out a little better on these next two slides. Original Medicare, what it covers and what it doesn't cover unless you select a specific additional plan. So original Medicare covers A and B, does not cover drugs unless you actively select a drug plan. And if you don't select that drug plan when you enter Part D and you later want to join the drug plan, you have to pay a penalty. So it's important, unless you are continuing to work after age 65 and your employer is offering you a credible drug benefit, that you go ahead and select your drug plan at the time that you enroll in Medicare. One of the benefits of original Medicare, and I'm going to highlight this, is that when you have original Part A and Part B, you get to pick whatever doctor, whatever hospital you want to go to anywhere in the country. If you want to see a specialist and that specialist is in another state, You can go make an appointment and go see that specialist without having to get a referral, and Medicare will pay for that specialist in whatever state that you belong to. On the other hand, Medicare Advantage plans, they provide you a lower overall monthly cost, but they have limitations. In order to get that lower monthly cost, you have to go to an in-network doctor. If you want to see a specialist, you have to go to your gatekeeper doctor, your regular primary care doctor, and make sure that they are willing to refer you to that specialist. You can only get those low costs if you go to the hospital that is in your network. And so if you like to travel around the country or even travel out of the country, Medicare Advantage plans may be less desirable. If you are planning to stay in your same spot all the time and don't travel a lot, then Medicare Advantage can be very popular. So let me go back again and say, original Medicare, it's generally going to cost you more, but you get to have the choice of what doctor, what hospital you want to see, and it's going to cover you anywhere in the United States. Sometimes that Medigap policy or Medicare supplement that you add on may also cover you if you travel internationally. So if you're enjoying going, well, this is after COVID, after the pandemic is over, and we all feel comfortable traveling internationally, that Medicare supplement plan, you have an option of choosing a plan that will also provide you coverage if you are out of the United States. The Medicare Advantage plan gives you some additional benefits. It's lower cost, and sometimes it will cover dental or vision or hearing or sometimes gym memberships. Now, a few Medicare plans, and you'll see this advertised on television a lot, may also cover transportation to the doctor. It may cover assistance with meals. It may even offer assistance with some care in the home. But I caution you, if you are listening to these TV ads, to always double check to see if those additional wonderful services that they advertise on TV are actually available in your zip code. Because many times those add-on services that Medicare Advantage plans offer are only available in very restricted zip codes, and it may not be available to you. As a matter of fact, if you select a health plan and you select a plan because services are available in your zip code and you move, you either go buy a second home down in a warm climate and you go and spend half the year in that second home, or you just actually move to be closer to a child or a grandchild, and that plan doesn't offer those same services in your new zip code, you have the ability to change your plan in the middle of the year. So there are special instances where you can change your plan when your needs change. And that's also important. Many people think that when they enter Medicare, they're stuck in that plan until the next year. We'll talk about those special enrollment periods. I also want to let you know that the majority of people, and this is probably human nature, we tend not to change very often. But whatever plan they select when they enter the Medicare program is the plan they end up staying in for the rest of their lives, even though every single year you have the opportunity to evaluate and decide if you want to change your plan. So I highly recommend that you and any of your friends and family and loved ones that are in the Medicare program walk through this process every year between the middle of October, and you can actually start investigating plans October 1st. Which is why we're going to be taking a look at the 2022 plans when I get to the internet at the end of our show to talk you through how to do this. But these are the biggest differences between being in original Medicare and being in Medicare Advantage. So you can see original Medicare doesn't cover your gym membership, doesn't cover dental or vision or hearing, but you get to choose whatever doctor you want to go to. Medicare Advantage gives you a lot more perks, but they control which doctors you're able to see. Now, I'll also let you know this. Medicare Advantage negotiates lower reimbursement to doctors and hospitals and to nursing homes if you need rehab care. So if you want to go to the very best hospital or the very best nursing home, if for instance, someone with a mobility issue falls and breaks a hip and has to get a hip replacement and needs therapy to relearn how to walk and move and regain function and goes to a nursing facility for that. If you have original Medicare, you're more likely to be able to get into any facility you want to, because original Medicare pays better to the healthcare provider than Medicare Advantage plans. Many people, as they approach the end of their lives, will change from being in a Medicare Advantage plan back to original Medicare because it gives them better options for their treatment. And again, you have that option to change your plan several different times throughout the year for certain instances. Going into a nursing home is one of those. So selecting the right plan for you. The initial enrollment period starts 3 months before you turn 65, the month that you do turn 65, and 3 months after you turn 65. So you have 7 months around your 65th birthday to enroll in Medicare. And as you approach that, you will be getting tons and tons and tons of information, because all these private health companies, these insurance companies, would like you to select their Medicare program. Now, the annual enrollment we've already talked about, and we're just getting ready to start that period. And then the special enrollment periods that I talked about. If you move, you have the option to select a different plan. If you go into a nursing home, you can select a different plan. While you're in the nursing home, and this holds true for long-term care hospitals as well, you can change your plan every single month while you're in the nursing home. Because if your health is changing and you need to be on a different medication and perhaps your previous plan didn't cover that medication, you can change to a new plan that will begin the following month that will then provide perhaps better coverage for the drugs that you need. And then, excuse me, I have allergies. If you qualify for Medicaid, Medicaid is a income dependent Medicare medical coverage for people that have become having an income less than the poverty level. So if you become eligible for Medicaid, then you can choose a different plan at that time too. So we have these special enrollment periods, and you should stay in touch with Medicare or someone that can advise you when it might be an opportunity for you to consider changing your plans. Now, when it comes time to picking the right plan for you, I'm going to show you, we're going to walk through together on the Medicare.gov website how to look up all this information. But because I'm hoping some of you will download the slide deck, I've basically drafted it out, the process on these next few slides. So basically, you will be receiving phone calls, emails, and television commercials with 800 numbers and websites that you should go to enroll in Medicare or select a plan. But remember, everything that you see is, unless it says Medicare.gov, and I've got this in blue at the top, www.medicare.gov. If it's anything other than that, they're going to try to direct you to their plan offerings, whether it's Humana, AARP, Cigna, United, whatever insurance company it is. They're going to try to direct you to their plans. And they may have 8 or 10 different plans for you to pick from, but that might not be the right plan for you. If you go to Medicare.gov, you get the only unbiased source of all the different plan options that could be available to you. You select what type of Medicare you're interested in, either original Medicare or Medicare Advantage. Even if you checked and are currently enrolled in Medicare Advantage, you can switch back to original Medicare at the during this enrollment process, and vice versa. Now, when you're going through this process, you select one or the other, you go and get all the information regarding the best plans for you under original Medicare. Then you go back to Medicare.gov and start over and look at your Medicare Advantage plans. This is information gathering, and we've got time if you start at the beginning of October, to make a decision before that December 7th final determination. Now, when you decide which one you want to look at first, then you enter your zip code and they'll ask you questions. Do you get any help paying for drugs? Because if, for instance, you are dual eligible for both Medicare and Medicaid because of your income level, certain plans will give you a zero copay, zero premium, zero deductible if you're dual eligible. So you want to make sure if you qualify for that, that you put that in. So they're only going to show you the options that give you the full coverage. And then you enter the drugs that you're taking, or even drugs you're considering taking. So in our example today, we're going to put in some drugs that are common for Parkinson's patients. And then we're going to put in addition, some drugs we think we might need during the year, because this is just getting an idea about how different plans cover drugs that you might be considering taking, as well as the ones that you know you already take. And then you can select up to 5 different pharmacies, and you can determine whether you want them within a 1, 5, 10, or 25-mile radius of your zip code. And you can select 5 different pharmacies, and it's going to show you the exact price that you would pay for each of those drugs at each of those 5 local pharmacies that you're going to pick. And then the Medicare.gov site will then sort your drugs, your drug plans, or your Medicare plans automatically with the most cost-effective one at the top, followed by the next. But you can get so much additional information. So once you have your top 5 plans, or you might scroll through and decide that you really are interested in plan number 1, 2, 7, and 10, you just write down or jot down the plans you're interested in, and then go back and look at the details on each of those plans. So you can click on plan details, and then you can click and you can look about the plan. Then you can click on view drugs and their costs. And then you can even click on view more drug coverage, and it would let you know which drugs might require a prior authorization before they will be covered, or ones that might require a step therapy, which generally means you'll have to try a formulary alternative before they will pay for that drug. And if there is a drug that requires a prior authorization, there is a link to the plan's website, and you can actually go find out the exact criteria that the plan is going to need in order to be able to get that drug paid for by the plan. So we're going to walk through that process. I'm keeping an eye on the time. We're going to walk through that process and get you familiar with that website. But before we do that, I want to bring up a couple of more options, because the title of this session is Making Medicare Work for You, not just picking the best Medicare program. So what is it about making Medicare work for you? And in this case, if you do have a medication that you or your loved one needs that requires a prior authorization, I want you to know that the Medicare beneficiary or their designated responsible partier can actually file the prior authorization request. It doesn't have to be done by the doctor. You can take charge. And if you're not the patient, if you're not the Medicare beneficiary, you do have to go onto the Medicare.gov website, and there is a place where where the Medicare beneficiary can designate an individual, usually a family member, but it could be even a friend, to be their legal responsible party, who can then fill out all of this documentation on the Medicare beneficiary's behalf. But if the Medicare beneficiary is capable, you can do this as well. Now, your doctor can also submit for prior authorization, and in some certain instances, the doctor does need to be involved. But you, as the beneficiary, have the right to fight the plan to cover the drug for you. And the prior authorization form is a 4-page form. In Medicare programs, it's the exact same form. The only thing that changes will be the logo of the Medicare plan the drug plan and the address. It's important because you're going to need that fax number if you're filling this out yourself. The doctors oftentimes are able to go online. All of these Medicare drug benefit programs offer an online portal, and the doctor can fill out this prior authorization online. But I just want to make you familiar with what is important, because I do find that prior authorizations get approved more often if the doctor is the one that fills it out. But I also have found in my 40 years of working to get patients access to drugs that they need, is that the more information you as the Medicare beneficiary or the responsible party can complete or provide to the physician in order to facilitate getting this form filled out, the more likely the plan is to approve your request. So we have a spot here on the front page to fill out the enrollees information, the Medicare patient's information. And then the second section is complete this following section only if the person making the request is not the enrollee or the prescriber. So if you're the responsible party, you would fill out that bottom section on page 1. And then on page 2, it says to check the type of coverage determination requested. So the first box is, I need a drug that is not on the plan's list of covered drugs, which would be a formulary exception. Or I have been using a drug that was previously included on the plan's list of covered drugs, the formulary, but has been removed from the list. So last year you covered it. This coming year, you're not going to cover it anymore. I need to stay on this drug. That's an option. I request prior authorization for the drug my prescriber has prescribed. I request an exception to the requirement that I try another drug before I get the drug my prescriber prescribed. That would be a step therapy. I request an exception to the plan's limit on the number of pills I can receive, because many plans put a 30-day quantity limit on a prescription. And if you need more, then you can request that exception. You also, and a lot of people don't realize this with the Medicare program, but you have the right to request to receive your drug at a lower copay. So that's in the middle of the box. My drug plan charges a higher copay for the drug my prescriber prescribed than it charges for another drug that treats my condition, and I want to pay the lower copay. Did you know that you had that option? That you don't just have to pay the high copay? Now, with drugs that are in specialty tiers, it's the lowest they will go down is to the lowest specialty tier. They won't take it down to like a preferred drug or generic copay. But if you do have a high copay drug, there's always the opportunity for you to request to be able to receive that drug with a lower copay. So that's one of your entitlements in the Medicare program. So we have all these different choices, and you would check which one applied to you. But if you are asking for a formulary or tiering exception, and you notice that many of those have at the end parenthesis formulary exception and an asterisk, if you're requesting that, then you do have to get your prescriber to sign the form. So like I said, most of the time, the plans are going to expect your physician to sign this form, but helping your physician to make sure this is filled out with what you know that you're going to need in order for the plan to agree or accept this prior authorization request is very important. Oh, one more thing on this page. Down at the very bottom, you'll see that check this box if you need a decision within 24 hours. Medicare Part D, the drug benefit, is mandated by law to provide a decision on a prior authorization request within 72 hours. However, if you check this box, they have to render their decision within 24 hours. I tell everybody, always check that box. Why would we need to wait 3 days for a coverage determination on a medication you need when you can just have to wait 24 hours? So always check that box. Remind your physicians to always check that box, and then we'll know by tomorrow if the plan is going to cover the product or give us a lower copay or if we're going to have to go to step 2, which is a redetermination. Now, here's page 3. And page 3 is where we enter the doctor's information. And then this is where we enter the name of the drug that is going to be, that we're requesting coverage for, and information about that drug, strength, frequency. Is this a new start? Or is this a drug that they've already been on before they entered this plan, or they were on last year and the plan covered it, but now the plan is asking for a prior authorization? Expected length of therapy, any drug allergies, height, weight, but the diagnoses, and I tell everybody, the tendency is the doctor tends to write the diagnoses for which the drug is being ordered. But I always advise, write every diagnosis, write the diagnoses that's pertinent for that drug first, maybe in all capital letters, and then go ahead and write all the other diagnoses that are pertinent for that individual, because we want to illustrate that this patient is frail. People with movement disorders typically have 4 other conditions for which they're being treated. And we want the plan to realize that these individuals do not have the fortitude to mess around with drug therapy. We could put them at risk. If we make a change in one drug therapy for their movement disorder, it may actually interfere and have a drug interaction with other medications they're taking for hypertension or diabetes. So we want to list all the diagnoses, just list the one that supports that drug first, and maybe in capital letters or underlined. And then they ask for the ICD-10 codes, and these are codes that correspond to the diagnoses that are used in electric healthcare transactions. So we have the diagnoses and other relevant diagnoses, very important. And then the drug history, particularly if they have attempted other drugs and that has failed to manage their condition, or those drugs have caused side effects that are risky for that patient or intolerable, then we need to include that information on page 3. And then page 4, there is a little bit more information about drug safety. Is there an FDA noted contraindication? Is there any noted drug interactions with the drug that we're considering using? Some questions on opioids, which are not pertinent to movement disorder, but people may be also on opioid for pain management. And then this is another area where the physician writes what the rationale for the request. So on page 2 is where you, as the family member or beneficiary, said, this is why I want this prior authorization. The rationale for request is where the doctor lists that alternate drugs have been considered or tried and they didn't work, or the patient is stable on current drugs and there is a high risk of significant adverse clinical outcomes with the medication change. That's the one I usually end up checking for people with movement disorders, because of the degree of frailty of individuals at the age that movement disorders become so apparent because of their comorbidities. Usually option number 2 is most reflective of the reason why we need them to be on this one particular medication. So this would then be completed and there is a place for the doctor to sign. But that is a prior authorization. And again, regardless of which drug plan you select, they all have the exact same form. It's just different logos and addresses on the top of page 1. Now, what happens if after you go through all of this process, the plan denies covering your drug? You have a right as a Medicare beneficiary or the responsible party to request a redetermination of the prescription drug denial. You can request this anytime within 60 days of receiving the first denial. Of course, if you or your loved one needs the medication, you need to turn around and get this out as soon as possible. Now, the website is right at the top of the slide that you can go, and this, when you go to this URL link, it gives you instructions of how to fill out this 2-page form. And you put, of course, the Medicare beneficiary and the name of the drug, the prescriber's information, The prescriber doesn't have to be the one to send this in. You, as the Medicare beneficiary or their responsible party, can send this in. This goes back to the plan. And basically, when this goes back to the plan, it will go higher up in management at that plan. So it may be a $15 an hour technician who reviewed your prior authorization request, may not have a medical background at all, and they're just checking to see if that prior authorization request ticked all the boxes in their coverage requirements. And if they denied coverage and you fill out this redetermination, that's going to generally kick it up to a medical practitioner, either a nurse or a physician at the plan level, who will then take another look at the information that you provided. And again, you can check this box if you need a decision within 72 hours. Generally, they can take 7 days to act on this redetermination. But if you check the box for 72 hours, then they have to let you know within 3 days. If you ever see those check the box, always check the box for a faster determination, because individuals that are suffering from movement disorder and the associated consequences, like off episodes or psychosis or depression, or many of the non-motor symptoms of Parkinson's disease and other movement disorders, we don't want to wait a week before getting them on therapy that might provide an improvement in their quality of life. So always check those boxes for a faster decision. So let's say that you filed that redetermination and it went back to the plan, and the plan once again denied coverage. You have a third option, and the third option is a request for reconsideration. So first we have the prior authorization, then we had redetermination, which goes back to the plan, but this request for reconsideration, that actually goes to an outside independent reviewer outside of the plan. And these are your, again, this is the URL that goes to the reconsideration. It explains the process. These are your rights under Medicare to push that Medicare plan to cover the drugs, because Medicare is obligated to cover the benefits you need as long as it is a benefit under the Medicare program. So some plans prefer to try to save money. We jokingly say that sometimes managed care is managed costs, and until we show them that we are aware of our entitlements under the Medicare program, and we go through these processes which are put in place to allow us to negotiate with the plan to ensure that they're covering medications that we need. There's a process similar to this for procedures. If you need a surgery or you need a specific type of mobility device and the plan is not willing to pay for it, there's a similar type of process on the other side of Medicare programs that you can go through as well. I, being a pharmacist, I specialize in drug therapy, so I'm walking you through these. But we have many options, and I just want you to be aware that just because a plan denies coverage doesn't mean it's the end of story, and that you're either going to have to pay out of pocket or forego getting the product. There are ways that you can elevate or escalate this up to an outside agency. And then there's a final way. I rarely find that it ever needs to happen, and that is, if this reconsideration were to get denied, then you can take it before an administrative law judge. But they're very backed up, and that can take 2, 3, 4 years to get approved. So and by that time, you probably aren't going to need that medication anymore. So usually we don't need to take it beyond this request for reconsideration. And they do, you can, once again, over on the second side, there's a little box down there. Check this box if you need a decision within 72 hours. Well, if you've added it all up, the prior authorization within 24 hours, the redetermination within 72 hours, the reconsideration within 72 hours. You can push this all the way to the top within 7 days to get the plan to pay for the drugs that you need. So we've got about 20 minutes left today, and I just want to walk you through, and I'm going to need to reshare my screen to get it off my slide deck. So bear with me a moment, and I will see if I can bring up the actual Medicare program. So Andrea, if you can see that screen that says medicare.gov, shake your head. Yes. Perfect. Thank you. All right. So if you go to medicare.gov today, this is what you will see. And you have an option. You'll see preview 2022 health and drug plans. So we're going to click that. Now, if you have a Medicare number, you can log in with your Medicare number. But today, and so you can log in here and create an account. And the nice thing about doing that, it's all private, is that once you start adding all your drugs, which could be 10 or 15 different drugs, once you're logged in, you can save that drug list. And that way you can come back to it later, or you can go back and look at your original Medicare plans and then go back and look at your Medicare Advantage plans, and you don't have to re-enter all of that. So it's good to log in, good to save it, so you can work with it, and you can change those drugs anytime that you need to once you've got your account set up. But today we'll just continue without logging in. Now, I remember that it says you're going to have to pick what kind of plan you want to look at. Do you want a Medicare Advantage plan? Do you want you've got original Medicare, you want to just pick a regular drug plan to add to your original Medicare? You can actually pick a drug plan plus a Medigap policy, or maybe you just want to look at Medigap policies that supplement. You can do that. If you want to just learn more about Medicare, many of the things I've already told you today, you can click on here. It will take you back through. In fact, all those slides I showed you in the very beginning were screenshots exactly from this website. So you can get all that data right here on the website. But to make it easy, I'm going to say that we have Medicare, original Medicare, and I just want to look at a drug plan. And then enter your zip code. And I'm going to enter an Atlanta zip code. So we'll see a lot of plans in Atlanta. This zip code crosses 2 counties. So you pick the county that you live in. And then it says, do you get help with cost from any of these programs? Now, if I select that I get help with Medicaid, then it's only going to show me the plans that have qualified for full subsidy from the federal government, which means that you pay zero premium, zero limited copay of like $9.50 for a brand name drug and $3.50 for a generic drug, regardless of what plan you choose. If you get Social Security supplemental, Medicare savings plan, I'm not sure. You can click I'm not sure. I'm going to say I don't get help from any of these programs. So the next thing it says is, do you want to see your drug costs with comparing plans? And yes, you do, because that's part of a plan comparison. And so you hit next, and now you begin typing in your drugs. So I know a lot of people here suffer from Parkinson's disease. So we'll type in some Parkinson's drugs. And this is the way it works. I'm going to type in, well, actually, I'm going to make it easy. I'm going to type in Sinemet. Now, probably all of y'all get Sinemet generic. I'm going to click Sinemet, and I'm going to hit add drug, and it's going to tell me a generic is available called carbidopa levodopa. And you go, well, yeah, that's what I'm taking. So I'm going to add the generic because I take the generic. And then you can select your dose. I take the 25/100, and I take it 4 times a day. So my quantity would be 120 every month. And the reason why we want to pick the strength and the quantity is it's going to tell you your exact drug cost for each of those 5 pharmacies you select. Add to my drug list. I want to add another drug. So maybe this time I want to put in, I'm thinking about switching to Rytari. I would not take Rytari and carbidopa levodopa together, but I'm thinking I might switch to Rytari. My doctor's been talking about it, so I want to see if that's covered too. So, and it didn't take it because I hit the wrong button. Rytari, add drug. It's going to ask me about the strength again and the actual strength that would equilibrate to what my carbidopa levodopa is, would be this strength. So I'm going to add that. And then I will add, let's add Nuplazid. That's a drug that I know is going to require a prior authorization, and it's going to be expensive. So we're going to add that, add to my drug list. Maybe we want to add another drug. Maybe everybody is taking, let's say, Comtan, which is a frequent drug we use to, it's called a COMT inhibitor, and we're going to add that drug, and it says it's available as a generic, so we'll take that generic, and we take it 4 times a day, so that would be 120. So we'll add to the drug list. So now we've got several drugs, and I'll just leave it at that, but you could continue to add drugs till you have all of the drugs that you're taking or considering that you might want to take. And then when you're done adding drugs, you click done. They're going to give you the option of putting in your zip code again. But it remembered it from the last time. If there's one particular pharmacy that you always use and you don't want to switch, you can type that pharmacy in here. But I always recommend that you select a distance that you might want to drive, and you click Find Pharmacies. And it's going to give you, well, a mail order pharmacy option. Being a pharmacist, I prefer that people have face-to-face interaction with their pharmacist. So I'm not going to click mail order, but you may want to do that depending on where you live, because oftentimes many of these plans have a much lower copay for mail order than they do for live pharmacy. But let's say I'm going to pick Kroger and CVS and Publix and Walgreens. And then, and if none of the ones you see, there is actually 6 lines of 60 different pharmacies within 10 miles in this particular area of Atlanta. But once I've picked all my pharmacies there, as you see that I have, I'm probably making you dizzy. I've got 4 pharmacies here. So let me pick one more. I'll do Brightview Pharmacy. So now I have all of my pharmacies, and I'll click done. And then I've already got my plans here. It's sorted my plans by lowest drug and premium cost. And it's showing me 10 of 23 drug plans. So I've got a couple of pages worth. This is a Humana Walmart Value RX plan. Now, remember, we're working on original Medicare. And so we're just looking at drug plans. It's going to tell me up here there may be Medicare Advantage plans available with lower drug costs, but we're looking, and there's apparently 52 available Medicare Advantage plans. If we wanted to switch and look at Medicare Advantage plans right now, we could click that and go look at them. But I want to get you a little bit more in the details while we've still got some time together. So this is the Humana Walmart Value RX plan. This is AARP, which is a very popular plan administered through United Healthcare, the Medicare RX Saver Plus. And it shows you the monthly premium is $45. For all the drugs we added, which Nuplazid was very expensive, your yearly drug and premium costs together would be $5,800 out of pocket. Your deductible before the plan would start paying would be $480. And that's very similar. Well, here your monthly premium at this Humana is $22.70, but your yearly drug cost for all your drugs that you've added, $54.86.37. So it's a little less than your yearly drug cost here. You see what you can evaluate? There's more information on plan details. So we'll go up here just to this top one. And if you click plan details, it gives you your total monthly premium, your drug deductible, the plan address. It gives you an option if there's lower cost for drugs that you take. It shows you your pharmacies. Remember, we picked those 5 pharmacies. There's 2 of them that are preferred, which means that if you use those pharmacies, your copays will be less than if you use the other pharmacies. And we can see that in a few minutes. So then if you just click back to search results, I wanted to show you how valuable it is if you go over here under drugs and view drugs and their costs. So here's that drug coverage by pharmacy, but keep scrolling down. You can see that for carbidopa levodopa for the 25-100 tablet, if you use a preferred pharmacy, it's $46.41, which is Publix, or Kroger. But if you go to CVS, it's $61.52. So it's $15 higher. It's $10 higher if you go to Walgreens, and almost that much if you go to Brightview. Now, the same is not true. So Publix is cheaper for your generics, but for Nuplazid, Publix is actually about $100 more expensive. Now, Nuplazid is a very expensive drug, and they are charging you a very high copay until you reach the donut hole. And Rytary is a very expensive drug. But it does tell you at the end of it, now this is yearly cost. So this isn't what you're going to pay by month. This is what you're going to pay for the whole year. This is your yearly cost. And your total yearly cost, by the time some drugs are more and some drugs are less, is actually quite similar across all those pharmacies. So even though it shows preferred, when you get down to the bottom, your total yearly cost, so you can expect to pay, if you pick this plan, $5,000 for the drugs you currently listed out of pocket. Now, if you go in a little deeper, it lets you know when you'll meet your deductible on these drugs. Will be in January. When you will enter the coverage gap will be in January. And then you'll get out of the coverage gap in March of 2022. And if you remember the coverage gap, or the donut hole as they call it, during the donut hole, you have to pay 25% of the cost of your drugs. And then after you get out of the donut hole, you generally only have to pay 5% of the cost of your drugs. So it depends on plans, because you can see here at CVS, you don't get out of the donut hole until April. But these other pharmacies cost a little bit more, but you get into the coverage gap, you get out of the coverage gap much sooner, which means a much higher percentage of your total cost will be covered. This is broken down by month, estimated costs. And then you can even view more drug coverage. You can learn about drug tiers and find out what exact tier each of those drugs are in. These are what the different copays are for the different tier that the drugs are in. As I scroll through, too fast for you to read, but this is just the plan information. And then this lets you know what tier each of your drugs are in. And here, this is very important. So clicking that more drug information, this lets you know if a drug requires a prior authorization or step therapy. Now, a step therapy, as long as you have been in that plan for some time, the plan already knows if you've already been on the drug that you have to try first. And there's either you don't have to do any paperwork, or the paperwork is real simple. For a prior authorization, you've got to fill out specific clinical criteria. And to do that, you have to get to the plan's website. So I'm going to go back up to the top, and at the very, very top, you click on plan website, and it will take you, this is the plan we've been looking at. And what I want to do is just see if I can get the prior authorization. So I want prior authorization criteria. See if we can get it with criteria. And you have to look through prior authorizations, generally click it, and then this is where the doctor would submit online. This is your Medicare drug list for prior authorization, list of covered drugs. And this, it takes you pretty deep, but if you keep digging, search the drug list. So I want 2022. I'm going to put in my 30005, search for plans. Fulton, it's going to just show me the Humana plans. So we were in the Humana Walmart value plan and search drug list. And well, you can't connect to my Medicare.gov drug because we didn't save my account. So we're just going to enter the drug name. So now we're looking at Nuplazid. And it's a 34 milligram capsule. And I'm checking coverage. We already know from the Medicare plan that it requires a prior authorization. And let's see. It's going to printable Medicare drug guides. I honestly did not expect to get this. I should have picked an easier plan, but I'm glad actually that we're doing this because not all the plans are easy to work with. And if the plans are keeping the prior authorization criteria this secret, that it's not just coming up and being very clear for you to see, that would be one reason I might not want to select that plan. So this is taking longer than I want, and I want to make sure that if anybody has questions, we have that available. So I'm going to go back to the Medicare site, but you can go directly to the plan's website and usually from this Medicare site, and usually all you need to do is type in prior authorization form or prior authorization criteria or prior authorization list, and you will be able to click right on the list that has all the drugs that they have prior authorization requirements for, and will specifically give you the criteria. Like they have to have a specific diagnosis, or they have to have a specific assessment with this type of can't even think of the word, this type of numeric grade on the assessment. You'll get that detail of information from most plans. If I run into a plan like Humana where it's too hard to find, then I'm going to go and start looking for maybe other treatment options. So I'm going to go back to the results and I'm going to say, boy, Humana was kind of hard to work with. Maybe I want to look at AARP and view their drugs and costs. And I see that the pharmacy Walgreens that I typically use is one of their preferreds. And I see that it's actually the lowest cost per year. And I'm really liking that. So if I come down and view more drug coverage information, I'm going to find Nuplazid is still, it's a tier 5. It requires prior authorization. And so if I go back up to the plan website, then I can look for prior authorization. I know we're getting down. Prior authorization, prescription redetermination request form. They've got all of these coverage determination and appeals. So you've got basically all those forms that I've told you about. But I actually want to see if I can get the criteria rather than just the forms. And plan forms and information. Let's see if it comes up here. Authorization forms and information, Medicare prescription, prior authorization for prescribers, and that's their site to go and get signed up. And this is their request form. This is the same one that I showed you. And if you get back to I'm going to see if I can find it. They make this difficult, but just keep looking through all of these pieces of information. This is their Medicare Advantage plan. So you can look, once you've decided you like perhaps AARP, you can look at a lot of the information for all of their different plan offerings. But before you get finished to go with whatever plan you think you want, my recommendation is to go back to the Medicare.gov. This is the only unbiased source of information. If you've decided that you want a particular plan and you're scrolling through and everything looks good with that plan, once the October 15th date rolls around, over here where it says open enrollment starts October 15th, you can click right from the Medicare website and have an opportunity to enroll in the plan right from the Medicare website. So you don't have to keep going out to each of these individual plan websites unless you just want to do more research. So we have hit the top of the hour, and I know this was a ton of information, and I've got time if you want to take a little bit more time if anybody has any questions or would like to share any information with us. But I hope that maybe you got some idea of all the detail, all the information that you have at your fingertips if you just go to the Medicare.gov website.
Thank you. Yes, we do have some questions that I've been tracking through the chat, and I'm glad that we did get into some of that very detailed, rabbit hole, just so everyone knows this isn't something you're going to bang out in 15 minutes, in the Starbucks drive-through line. Like, this is work. It's complex. And if it took, Dana a lot of time to navigate that, then it's going to take a layperson a lot of time too. So get your cup of coffee, get ready, maybe do it in partnership with a friend or a family member, but buckle down. But you can make Medicare work for you, and these tips are invaluable. So I picked a couple questions that I think are general and a lot of people will have. One person asked if you could give a summary again of the concept of the donut hole coverage gap, or if you know a link or a research that explains it in simple language.
So you can get a good explanation at the Medicare.gov website, and you can just put coverage gap or donut hole in the search term, and it will explain it. But I can tell you, in order to get the original Medicare drug program passed back in 2003 with the Medicare Modernization Act, and it implemented in 2006, the only way they could fund Medicare drug benefit at the time was to have this coverage gap that occurred. And it occurs at around the time you've spent $5,000 out of pocket. And that changes every year. So there's a limitation They call it your true out-of-pocket expenditure. And when you hit that amount, then you hit the gap, coverage gap, you go into the gap, and during the gap, even though you might have had a plan where you only paid, $5 for a generic and $10 for a brand name drug, when you get into that coverage gap or that donut hole, used to be you had to pay 100% of the drug cost, but we've been closing the donut hole. And today, you only have to pay 25% of the drug cost when you're in the donut hole. Used to be you had to pay 100%. Now you only have to pay 25%, but that can still be a lot of money. And then when you get through the donut hole, which is the time at which your total spend has reached about $5,000, then you're covered for 95% and you only have to pay 5% over that. They call it catastrophic coverage limit. And that may not have been that much more simplified, but if you go to the Medicare.gov website, you will be able to type in donut hole or coverage gap, and you can read it for yourself, and it hopefully will help clear things up.
Okay, there were a couple questions about what about is your doctor or which hospitals are covered? Can you shop around in the same way? Donna wondered about doctors who accept Medigap through versus Medicare Advantage. I'm shoving together a lot of questions, but hopefully you can address that a little bit.
So if you have original Medicare, you can go to any doctor that accepts Medicare in any state, at any hospital, in any city. If they accept Medicare and they accept that Medicare supplement that covers your 20% for your copay, you can go to any doctor. If you are in a Medicare Advantage plan, you can only go to the Medicare doctors in their network. So, for instance, you may have a primary care practitioner where you live that you love. And when you are considering entering Medicare, you may find that that primary care practitioner you had for the last 15 years doesn't participate for that plan. So you would have to select a new primary care practitioner if you wanted to stay with that Medicare Advantage plan. So not every doctor will take Medicare Advantage because they pay less than original Medicare.
Okay, thank you. A couple of people asked questions about maybe they're younger or maybe it was a retirement benefit, but if there's an option of work insurance through an employer, how do you compare that to these options? Should you always accept the work insurance because it's guaranteed to be better, or any advice around that question?
The advice around work insurance is you need to verify with the Human Resources Department that it is qualified, that it is a qualified medical benefit and a qualified drug benefit. If it is qualified, it means that it has been designated by the government as good or better than Medicare. And if your employer's benefit is as good or better than Medicare, you can stay with your employer benefit, and then at whatever time you leave work, you can enter Medicare without a penalty. If your employer plan is not qualified, either because your employer didn't submit the plan to CMS, Centers for Medicaid and Medicare Services, to be determined as qualified, or if it was found to be less than what the Medicare program offers. If it's not qualified and you stay in your work plan and don't go and choose Medicare when you turn 65, then later when you want to enter Medicare, you have to pay a penalty for entering late. If you think about it, Medicare wants a whole bunch of young 65, 66-year-old people paying into the system that aren't needing to use the resources. That's the whole concept of insurance, is a whole bunch of people pay in that don't need the resources to help fund for the people that do need it. So they want you to enter Medicare and start paying in as soon as you turn 65. But if you're in a qualified plan, you can stay in that qualified plan. And then when you enter later, when you finally do retire, there's no penalty.
Okay, and you asked if people had advice to share, and I'm going to call on Ken because he has some advice, and it was a lot to chat and type. So, Ken in Oregon, are you out there?
I am here. Can you hear me?
Yes.
Okay, good. I just wanted to kind of share a story. I was diagnosed in 2016. However, I went on Medicare in 2010. And so my neurologist prescribed Rytary for me. And obviously, we needed prior authorization. So we got that no problem. And I did that for the next several years. We knew that each year, because I typically switch plans as their prices change around. So each year we would just have to get a prior authorization. Well, this past year, I made the mistake of not seeing that with Humana, which I went with, they had a little small print that said ST for step therapy. And I missed that one. And so we went for the prior authorization. They said, oh, no, you got to do step therapy. And the doctor wrote the letters. We went back and forth about it would be detrimental to me to try the other drugs because I'm stable on this one. And they denied it again. We did the redetermination. They denied that. We did the reconsideration. They denied that. And I finally went to the administrative law judge and we finally got it covered. But I'll tell you, it was a lot of work on my part, on the doctor's part. So be ultra careful about when they say step therapy, because that's the one that's going to nail you.
That will nail you. Also, the plan that you were talking about is one of the more problematic plans of the ones that are offered. So just, I don't want to badmouth any one particular plan, but I hear more problems with that provider than, or with that health plan than I do many of the other ones. Even though it shows up as being the cheapest often, it doesn't mean that it is offering the best coverage and care.
I think you get what you pay for.
Yep, I agree.
That's an original concept, by the way.
Well, thank you for sharing that, Ken. I think there were also questions when people were wondering if that reconsideration and, prior auth, if that was just a pipe dream or if anyone actually, reads those submissions. So
They do.
So that is,
It's
yes,
not a
very
pipe
welcome.
dream. Health plans in general expect that when they put a prior authorization restriction or step therapy restriction on a drug, that at least 30% of the time the doctor will not bother. And so they know that that's going to keep 30% of the people that need to be on the drug from ever getting on the drug. They also know that if people aren't familiar with their drug being restricted with a prior authorization or step therapy, and they go to the pharmacy and the pharmacist just says, your plan doesn't cover this drug, that another 30% of people will just abandon the drug. They won't go back to the doctor. They just won't take it. And now Ken is, he's a prime example of where you need to be aware of your benefits. You need to understand your entitlements and understand your rights, and then work with your doctor to keep fighting for the drug you need. Because even if a drug is not on the formulary, Medicare has to cover it if it's the only drug that you can take.
Well, thank you. Those empowering words. It's a shame that is the reality, but that is the reality. So we will, buckle down. We'll be emailing you the slides for this. You can watch the recording, and again, reach out to us if you have specific questions. We always recommend talking about it at your support group, or maybe some of your local community will have specific information about specific local plans. And thank you so much, Dr. Saffel. I happen to know you're tuning in from your vacation at the Albuquerque Balloon Fiesta. So thank you for joining us, for teaching us, and then for staying late so we could get in some Q&A. We really, really appreciate it.
Well, it was my pleasure. I'm happy to. And if somebody has a question that comes in, you guys at PDMA can just shoot it my way. And if I can, I'll answer it if it's something I can help with.
Okay, very good. Well, we'll close with doing a little wave of gratitude for this information, and good luck to all of you, sending you energy as you start to decipher these plans and make them work for you between now and the open enrollment date.
Great.
Okay,
Thank
bye
you very
now.
much.
Thank you, everyone.
Bye.